As respiratory illnesses in Toronto are on the rise, health experts warn of an increased risk at our schools.
Schools in general mimic what's going on in the community. And so we are certainly seeing that this is the height of our respiratory illness season. COVID, flu, and RSV are all at high levels in general.
Toronto Public Health recorded over 570 cases of influenza and a nearly 11% COVID-19 positivity rate in the second week of January.
COVID has actually been around since the fall and is continuing at high levels throughout. Flu continues to go up, so it may even get worse. RSV, thankfully, seems to be on the downward trend.
According to the city's wastewater data, as of January 14th, officials report high activity levels of COVID, RSV, and influenza A.
Part of it, the rise in these viruses, is because it's colder, we're spending more time indoors, and so that also encourages the virus to spread more at this time of year.
Earlier this week, Toronto Public Health released a reminder for parents and students to help limit the spread of respiratory infections in schools.
If we're sick, better to stay home than to go into the classroom and risk infecting others. Washing our hands as often as we can. If we have to cough or sneeze, to do it into our sleeve or our elbow.
Dr. Dubé says wearing a mask and staying up to date on your vaccines are among some of the best ways to protect yourself and those most vulnerable this season.
And new this year is we have RSV immunization program for infants. And so this has been really tremendous and I think has played a big role in why our youngest infants are better protected against RSV this year.
Dr. Dubé says there are vaccines for COVID and flu still available. So for more information, head on over to your local pharmacy or healthcare provider. In Toronto, Rhianne Campbell, City News.